Good morning, everyone. Thank you so much for being here at our press conference for the Grass Broken No More International Overdose Awareness Day conference, where mothers will be speaking about their experiences of losing loved ones and their children to the overdose crisis. I'm gonna start off by saying again, thank you for being here. We really appreciate it. And we know that the overdose crisis is an ongoing crisis here in the United States. We know that a lot of people have ideas of how to deal with this crisis, but we as public health individuals and as parents know that a more public health focused solution to the overdose crisis is absolutely necessary. Today, you will hear from a number of parents who will explain some of their personal experiences with use and losing a loved one to the overdose crisis, and they will share what they know could and did help their families during this time. My name is Gloria Malone. I will be moderating the conversation today. And so I will turn it over to Dr. Tamara Holt in a moment. But the progression of this press conference, apologies. I will share a video shortly, then I'll turn it over to Dr. Tamara Holt. She will introduce herself, and then she will introduce each speaker before they share their remarks. We ask that you either put your questions in the chat or that you use the question and answer function at the bottom of your screen to type in your question. You can send those in at any time, but we will be answering questions at the end of the call. We also ask that if you have a direct question to one of the speakers, that you please state that in your question. If not, and anyone is able to answer that question, feel free to leave it without a directed name to it. I am going to share a video that we have created here at Vital Strategies that captures the heart of the importance of International Overdose Awareness Day and the need to shift from a punitive response to the overdose crisis and drug use to a more health-centered approach.
On International Overdose Awareness Day, we remember, we honor the
Apologies, I'm seeing that my screen has been paused. Let me reshare that for you all. I'm so sorry. We would think that we would all be superstars at Zoom, and yet we are not quite yet.
On International Overdose Awareness Day, we remember, we honor those lost to overdose, our mothers, our sons, our partners, and our friends. Their lives were full of meaning. Their stories ended too soon. On International Overdose Awareness Day, we act. The overdose crisis reaches every community. It's a public health emergency and a human one, fueled by stigma, isolation, systems that punish instead of protect. In the 1980s, as people were dying from HIV/AIDS, institutions dragged their feet. Community got practical. They passed out sterile syringes, shared life-saving knowledge, and built a movement grounded in compassion and survival. Today, harm reduction carries that legacy forward, showing that the way to address the overdose crisis is to meet people where they're at, without shame, without judgment. Harm reduction is an invitation and an embrace, motivated by the belief that every life has worth, no matter if you are struggling or searching for connection. On International Overdose Awareness Day, we remember, but we also recommit to naloxone in every hand, to spaces where people can use drugs more safely and live, to policies that prioritize care over punishment, to ending the stigma that keeps people silent and suffering. On International Overdose Awareness Day, our grief is a call to action. We fight in the names of those we've lost. We fight for a system that believes in the power to change, because we've seen it, the transformations, the recoveries, the lives reclaimed. Our love can drive change, and every name we speak is a vow, never forgotten, never in vain.
Thank you all, and I will turn it over to Dr. Tamara Alt.
Hello, everyone. Thank you to the speakers and to the press and other concerned community members who have decided to be with us today. We're here on the eve of Overdose Awareness Day, which is it's International Overdose Awareness Day, which is August 31st every year. This is my 14th Overdose Awareness Day speaking, advocating, grieving. I lost my son, Josh, at the age of 16 in 2012 to a heroin overdose. He died from shame, stigma, silence. He used alone in his bedroom, overdosed, aspirated, and died on the way to the hospital. He died from a completely preventable tragedy, which is overdose. And we're here in remembrance of all those we've lost, but also to stand up and say, we're not going to just sit in a corner and cry and mourn our children, but we're going to do something about it. I don't want someone to be me. I don't want someone 14 years, 14 birthdays, 14 Christmases, watching my son's friends have babies and get married, and he's still 16. He's in high school. He missed his prom the week after he died. So I do all this out of love for all the families out there who have a potential to lose someone, and to prevent other people from being us, all us speakers here today, and so many hundreds of thousands of families throughout our country. Today, I'm here in the capacity as Executive Director of GRASP, Broken No More. GRASP stands for Grief Recovery After Substance Passing, and we're a peer-led group that supports families, parents, children, spouses who've lost someone to overdose, because it's a very isolating grief. It's misunderstood, and people don't know the special circumstances that we deal with after losing someone to overdose. The Broken No More part of our group, which is really who is kind of sponsoring this along with Vital Strategies today, deals with drug policy and education. We want sane drug policies. We want drug policies that focus on health and education. And we take a step back from criminalization, from the failed war on drugs, which we know after billions of dollars, 40 years of incarcerating people, putting them in cages, shoving them into back alleys, it doesn't work. We have good scientific backed evidence that criminalization is not the answer. So we're here to stand up today and say enough, and to advocate for the things that work, like harm reduction, naloxone distribution, healthcare, dignity, respect, all the things that will keep our people alive, engage them in care, and engage them to care about themselves and to take care of each other. But when we create stigma and judgment, we push people into a black market for drugs. We push them into spaces where they can't ask for help, where they don't feel comfortable, where they know they're going to be turned away, they're going to be judged. And so more will die. So we're here to stand up for positive change as it relates to our drug policy, positive change as it relates to people who use drugs, because it's really the only way forward. I'm also the founder of Jolt Harm Reduction, and we went from distributing just naloxone on the streets to whoever I could get to take it, putting together kits on my dining room table, going around crying and begging people to take naloxone, to a fully functioning harm reduction program, including syringe access, drug checking, recovery services. But it's been a battle every step of the way. And we're seeing throughout the country, syringe access services are being cut down, funding is being slashed. Things that we know will save lives are being thrown out. So it's enough about me, but you know why I'm here and why this matters so much to me. And I will hopefully always continue this fight, always with my son standing behind me. I know what he would want. He was a kind, generous, amazing soul. And I know he'd want us to do this work. I know he'd want us to be their voices, because our children don't have a voice anymore. We are their voice, and we're here to make change. So I will turn this over to our first speaker, Kimberly Douglas, who lost her 17-year-old son, Bryce, and she is the founder of Black Moms Against Overdose. And Kimberly is from Maryland. Thank you, Kimberly.
Thank you, Tammy. Thank you, Gloria. I'm happy. Well, I'm happy to be here today. I'm just not happy for the circumstances in which why I'm here, but I'm happy to be on the panel with you all. In June of 2023, I lost my 17-year-old son, Bryce, to fentanyl poisoning. He died just a month after graduating high school and only 5 days before his 18th birthday. Bryce was loving, kind, smart, funny, and creative. He loved to listen to music, draw pictures, watch anime, play video games, skateboard, and hang out with his friends. As a young child, Bryce was diagnosed with ADHD. So growing up, he was used to taking medication daily. During the pandemic, my family and I realized that he began to experiment, first with over-the-counter drugs, then with marijuana, and then when school opened back up, him and a group of friends began to experiment with pills. After Bryce passed, I looked for other mothers who had lost children to overdose. Talking helped with the emptiness, but I often found that I was the only mother, or the only Black mother rather, in the room, and often the only one questioning harmful drug policies. Too many grieving families are encouraged to support drug-induced homicide laws, not realizing that those laws disproportionately harm Black and Brown communities. My family and I later learned that the person who sold Bryce the fake Percocet was likely a friend, just a 15-year-old young man, Black boy. I'm heartbroken and I'm angry, but I don't believe locking up a 15-year-old is the answer. Punishment won't bring my son back. It will only add more harm to a system that is already broken. We're in the middle of the worst overdose crisis in history. Nearly 80,000 lives are lost to overdose every year. And on International Overdose Awareness Day, we come together and remember our loved ones, to honor their lives and to demand real solutions. Right now, some politicians and law enforcement are using this crisis to push the same old failed drug war policies, like long mandatory sentences and drug-induced homicide charges. These do not save lives. They fill prisons, they target Black and poor communities, and they make the overdose crisis worse. Our prisons are full of people who need healing, not punishment. Black people in poor communities are far more likely to be criminalized instead of offered care. We cannot arrest our way out of this crisis. Grieving for any family is difficult, but grieving as a Black mom has been lonely and heavy. In our culture, just like in other people of color cultures, we just don't talk about it. We're expected to be strong, to carry it all, but strength should not mean silence. Our grief is real and it deserves space. We cannot stay silent anymore. That's why I started Black Moms Against Overdose, a space where Black mothers can grieve openly, support one another, and fight stigma. We share our stories because our voices matter and because silence does not save lives. Addiction and overdose are moral failures. They are health issues. Every family should feel safe talking about them and seeking help. Families like mine don't want more punishment. We want compassion, care, and proven solutions. We will keep showing up, keep speaking out, and keep reminding lawmakers that the drug war has failed. We won't let them repeat it again. Sadly, my baby boy Bryce will never walk back through my front door, but I will keep fighting so that other families don't have to feel this pain. My grief has a purpose now, to turn pain into action and to replace punishment with compassion. Thank you for letting me share Bryce's story.
Thank you so much, Kimberly. We appreciate everything that you said and everything that you're doing in honor of your son. Our next speaker is Jessie Dunleavy, who lost her 34-year-old son, Paul, and she is an advocate for drug policy reform. And Jessie is from Maryland.
Hi. I did lose my son to overdose, and I realized then that his death was preventable. My overwhelming grief catapulted me into studying the forces at play. I wasn't driven by revenge, but by just a need to understand. So I read journals and books and reached out to thought leaders in the country, scientists, journalists, researchers, many of whom surprised me by taking time to answer my questions. And I joined organizations, I attended national conferences, and I testified, and I still do. I've done it for years now. My son, Paul, was different. He struggled all of his life with neurological differences. There was no label for his condition, despite the multiple professional evaluations that I saw. Among his handicaps were a language impairment and a hand tremor, both of which kept him from expressing himself in school. So his ability to communicate was compromised, and he went through school in special education and for the most part was misunderstood and underestimated. He had an abundant capacity for empathy, and he was intuitive and sweet. But his word retrieval was so slow that he was reluctant to join in a group conversation, so he was socially awkward. His teachers adored him, characterizing him as sensitive and kind, but he was trapped inside of himself and capable of higher level reasoning than he could ever demonstrate. He was very close to me and our family, but otherwise he didn't have a lot of peer interaction. As he grew older, he was marginalized and he was aware that he was bullied, he was a target, and his deep-seated feelings of inadequacy grew. He turned to drugs in his 20s, and it was never a social thing. I know now full well that it was masking his pain, and how very sad it is for all of our children whose discovery of a drug at first hides that persistent pain. It dulls it. And it seems like an opportunity to join others and to move forward, and it gives you new hope. And the tragedy is, it's the beginning of the road to more suffering than you ever knew beforehand. Throughout his life, he was treated by healthcare professionals, but that came to a screeching halt when he was incarcerated at one point. And during that time, it was a nightmare. He was hungry consistently. He was robbed. And then, because he was always the target, he was sexually abused. When he got out, he was despondent. He felt worse about himself than ever before. Plus, he couldn't find employment. After many, many discouraging years, he finally got on the right track. He got a job that he loved, and he was happy. He had his first apartment, but he relapsed. And he turned to me, and together we sought help. But we struck out at every turn. So at this point, I know that our priority as a nation has to be on the people who are suffering. If you think about all the people who are involved in this crisis that we're facing, from the people who suffer with addiction, to families, to treatment providers, to legislators, who is it that needs the most help? Who is it that's at risk of dying? We need to focus on them. It just seems so much common sense to me. And harm reduction initiatives do just that. They prioritize those who suffer, and they afford them the dignity they deserve and the health care that they need. So beyond the crucial component of keeping people alive, these initiatives also instill in people the incentive to work toward a better life. And that paves the way to recovery. Simply put, we cannot continue our failed practices of disempowering those that are most at risk, of removing resources from them and isolating them and making it harder for them to take care of themselves. Shaming people only pushes them into back alleys. Isolating them increases their chances of using alone and dying. The drug war has brought us crime, violence, dangerous substances, and racial inequity. We need to do everything possible to eradicate the inequality by ending the practice of arrests that target the already marginalized. Make no mistake, the drug war has also created our biggest barrier, and that's stigma. And it's stigma that's fueled and normalized oppression. And it's a huge culprit, but we will never overcome it as long as we criminalize the behavior that we're trying to destigmatize. So I've never understood why we're comfortable with jails and prisons where dehumanization is the norm and downright abuse is routine, but we're uncomfortable with evidence-based healthcare that has proven beyond question to reduce deaths while bolstering the likelihood of recovery. How do we get legislative buy-in for the life-saving, health-centered policies? Our challenges right now seem greater than ever, but it's all the more reason to keep up our efforts to promote common sense, proven initiatives. And so in Paul's name, I pray every day for a breakthrough in greater understanding. Thank you so much.
Thank you, Jesse, for your wise words, for your call to action. I agree with absolutely everything you said. As a mother and someone who cares deeply, and I appreciate you speaking today. Our next speaker is Aisha Betancourt, who lost her daughter Brianna, and she's founder of the Brianna Land Project, and she is from Illinois.
Good morning. Thank you for having me. Much of my conversation when I speak to people sounds like Kim's conversation to us. I say a lot of those things. I also will talk about my daughter Brianna, who was my best friend. I was a young mom, very young, and so we kind of grew up together. Let me see if you can see this real quick. You can see her. That's her during her senior year, her graduation year, where she started to experiment like a lot of kids do. Alcohol, of course, cannabis. She was able to use those substances on the weekend, just like the rest of her friends. But of that group of like 10 friends, she's the only one who's deceased now. She was so sharp, though. She spoke at her graduation as senior class president. She was well liked within the school community with her counselors. To this day, I'm welcome into the school because of her, because they liked her so much that they want me to tell her story at her schools. She was able to still get herself into Illinois State. While she was at Illinois State, she partied some more and she started taking some Adderall, and she lost her scholarship, came home, and there was a cycle that began of her staying with me, her staying with my mom, her grandma, her dad, just going from house to house, because at every point in that stay, she would end up clearly out of it, where we in the beginning thought it was just alcohol. We've later come to discover that when she was about 19, a doctor, her primary care physician, prescribed her Xanax for her sleeplessness and anxiety. Another doctor that same year ended up prescribing her pain relievers for chronic pancreatitis. I didn't know much about this subject, or how to help, or how to question things. If a doctor's involved, it has to be okay. And of course, as an adult, I was unable to see any of her medical records. On May 15th, 2019, she had been staying with a friend after exhausting everybody who loved her's home. And she ended up not being able to wake up. They called the ambulance, and shortly after, she was pronounced deceased. And it was the most painful thing that you can imagine. As a mother, this is not supposed to happen. I prayed every morning for her, and I said, God, you love her more than I do. Please take care of her. And unfortunately, she was no longer with us. It was at that point that I heard my ear that said, Aisha, what are you going to do with this pain? And within a week, we had a group session with so many members of the community to talk about mental health and to talk about substance use disorder. Because one thing I knew for sure was that Xanax was going to be part of her toxicology. I didn't realize 6 weeks later that it would not just be Xanax, but was also heroin. She had no money at the end. She had no anybody to trust at the end. And that was really the only way she could go, because she was under stigma, under shame, a lack of understanding on my part. All I knew about substance use disorder was tough love, because that's what the show Intervention on A&E taught me. That's all I knew. And if I was so ride or die for my daughter, how did I leave her out there? How did I leave her out there to fend for herself? I didn't give her my all at the end of her life. Because of losing her, I decided I'm going to learn everything that I can about this issue, everything that I missed. And then I'm going to relay this information to members in my community. I was able to hook up with 2 other moms from the same high school whose sons passed away as the result of substances. And together we go into schools. Like I said, we do like International Overdose Awareness Day, where we raise money to help a future family that will lose their loved one. And with everything that's happening right now, what is so important to know is that the public is not educating themselves about this until it's too late. The problem is we have members of leadership in leadership positions that are saying something because it sounds good, but they really don't know. If they did their research, they would know that every single law has been made in effect due to something that is racially motivated, classism, and that's how they came about. And what happens is, and what will happen, continue to happen, is that there are going to be communities that are able to survive any of these funding cuts, that are able to survive their own substance use because they either have the money or they're not in low income or impoverished areas. It's proven. There are studies, and constituents like to hear certain things that sound good, not where that politician doesn't know everything, hasn't done their homework. And it's very tough that it's up to moms like us to educate the public. And it's who wants to listen to us? We do our best, but we need the support of leadership. It costs less to have someone to provide harm reduction services to a person than it does to keep them incarcerated for a year. Every time I see somebody and I work with somebody, I see my daughter. I know that she did not need jail time. She needed help. And we are failing our kids. We are going to have a new generation of kids. My daughter left a son who is now 8 years old. He has more than twice as much a chance of having substance use disorder, in addition to the trauma of his mom being gone. How will we handle that then if we're not working towards something successful now? We have to continue to help, and we have to open our eyes and educate more people on the overdose prevention sites. They're not just, hey, come over here, let's do drugs. No, there's connection there. There's community there. There's humanity there. They're just helping them out to stay alive until they're ready to make a change. And right now, as it is, without overdose prevention sites, they don't have that opportunity. And so we're already working against the stigma and the shame. And now it's time for us to start really learning more so that we can keep our communities safe and alive.
Thank you so much. We appreciate you sharing today. Our final speaker is Anita Garrett, who lost her 31-year-old son, Sammy. and she is from Wisconsin.
Hi, thank you all for allowing me to come on here. Right now, I'm a little bit emotional, so I'm going to be able to do this. First of all, I'm a recovering addict myself. I have been clean for 16 years now. My son has been dead for 16 years. So right now, I'm listening to all the stories. I just really just brought back a lot of memories and really got me a little bit choked up. But I'm going to continue to do this because I know it's powerful and I know it needs to be done. So, hello, my name is Anita Garrett. I'm here today because I lost my son to a drug overdose, a senseless, preventable overdose. My son was at a party surrounded by people which he thought was his friends. When he OD'd, instead of his friends helping him, everyone fled. They were afraid of prosecution, afraid of going to jail because drugs were on site. No mother should ever have to live with the pain of knowing that their child was left alone in their final moments. That pain is something that I carry with me every day, but I have chosen to turn my pain into purpose. I share my story so that no other mothers or no other family have to go through what I have endured. I want people to know that a life is always worth saving. Through my work with Vital Strategy and Connections, I have raised awareness about overdose and prevention. We need to create a culture where people know where they have the power to save life without fear of punishment. Knowledge, compassion, and courage that can make the difference between life and death. Today, during our Drug Overdose Prevention Month, I honor my son, Sammy Garrett, and speaking out for remembering him because I'm going to tell you a little bit about Sam because I've seen all the other mothers did it. My son was 6'6". He was supposed to be an NBA basketball player all through high school. He won numerous of trophies, which had people's reaching out, wanting him to be on the basketball team, play professional basketball. But he just got with the wrong group. And then I'm not blaming myself, but doing my drug addiction for all those years, I guess he's seen me doing this. And I don't know if that affected him and his decision to go down that path to do drugs. He died on ecstasy pills. I don't know if you guys know about it. I didn't know about it. It's a pill that the young people's take that takes them that make them do things that they normally wouldn't do because he was a kind. He would give you the shoes off his feet, the clothes off his back. No, everyone said just nice things about him. So that's why it hurts me so much. Why did this happen to happen? Why did it turn this way? But I can't bring him back. So, like I said before, I connected with Vital Strategies. You have the power to save lives, to bring an awareness to other family members so they don't have to feel this pain that I carry every day. But like I said, through that pain, I'm making it out of a purpose. And I go out and I tell people my story to let them know that it's okay. I meet people's where they at, you know. I'm not ashamed to tell my story. Like I'm not ashamed to tell you guys on this media press that I was addicted to crack cocaine. So doing this, I'm bringing awareness. I'm also sharing resources with other families, faith-based leaders, community organizers, everyone, to let them know that naloxone should be carried not only in your home, but also in your car. Carry it everywhere because you have that power to save a life, and a life is worth saving. I do this in honor of my son, Sammy Garrett. Thank you so much.
Thank you so much, Anita. Gloria, are you stepping up now?
I just want to take a moment to say thank you to all of our speakers and for all of us who are listening to just take a deep breath. That was a lot. That was a lot of emotions. That was a lot of experiences. And these are real stories, right? These are human stories through and through. And it's a lot to take in the midday, midweek. But these are the realities that thousands of families are living with here in the United States right now. And we hope that through hearing these stories, that when you hear about someone passing from an overdose, or you see a news article that says something or reports on something, that you will remember this moment and the real emotions that are taking place right now in yourself, and then these mothers who are sharing the stories of their loved ones and their children. Um, these are the types of stories and voices that need to be added to our advocacy efforts, to our media that portrays things in certain ways, to our public health policies, to our governmental policies, and to conversations that we have, right? We've heard from all these mothers how stigma and shame led to further isolation of not only their children, but also of them as their parent, and now as their parent doing this advocacy work in the name of their children. And so before you want to go out there and, start, talking to elected officials and all of that, which I hope that you do, and that you bring a more health-centered approach when you talk to your elected officials or write them an email, that we all have work to do around destigmatizing the language and the thoughts that we have about people who use drugs, what those experiences look like, what type of families they come from, and all of these outdated, narrow, stereotypical definitions and thoughts that we have when we hear about people who use drugs or people who are unhoused. This is what International Overdose Awareness Day is all about. It's a moment for us to reflect, and to reflect with the desire to continue the actions that we know can change and save lives. You all are doing this. You all, our speakers, are doing this in a number of different ways. And I'm so grateful that you all, our listeners, are here to hear this different perspective, and that I hope it really stays with you. As a reminder, we can still submit questions if you would like. One of the first questions that we got was, how, the question, I apologize, is how can we as professionals in the field fight stigma when parents who have lost loved ones to substance overdose use stigmatizing language themselves? How can we do this with dignity and respect? Would any of our speakers like to answer that question?
Yeah, I mean, dealing with people on grasp, okay, we're dealing with grieving families, and there's often very stigmatizing language there. And so we'll put up, maybe a gentle reminder about language. We have to kind of pick our battles, I guess. And, all we can do is we speak without stigma, with, terms, in remission and recovery versus clean, dirty, all those things. And we try and educate in a kind way. But there's a lot of, I even see, people labeling, like, what do they say? My addicted son or something, like initials, like that's all they are, and these are parents saying this. So we see it all the time. I think it's just be kind, be gentle. You're dealing with grieving parents who probably, they don't know any better. I mean, I had to learn all these terms in the beginning. I didn't know what was better. You just hear. I mean, I sort of knew as a medical professional, but it's hard. Just keep using the right language and you hope people pick up on it. I still hear, I'm in like a perinatal addiction committee, and there was a physician on there yesterday who said substance abuse. And I didn't know him, so I just kind of bit my tongue, but I want to say, we don't say abuse, we say substance use disorder, but it's everywhere. It really is everywhere. And I think it's just some of it's just a lack of education, not malice, so just keep using the right language, and we hope people will follow along.
Would anybody else like to answer that question before we move on to the next one?
I just want to chime in and say I agree with Tammy. I think you have to give these grieving families a little bit of grace. I know after my son passed away, I like Aisha, I literally jumped into just trying to learn as much as I could. And I found myself connecting with a lot of organizations that were dealing with that were promoting drug induced homicide laws. And so, I knew that wasn't my values and what I wanted to focus on. But, the language on that side is vastly different than the language on the harm reduction side. So I feel like we just need to give each other grace, and we need to remind folks that as, you know, we are learning in this process. Although we're grieving, we're learning also. So just kind of keep that in mind.
I want to follow up on that because when I lost Sam, and I'm like you said, language is very important, and I said I got clean. What I mean is, I recovered from drugs. Being on drugs for 20 years, I was on it for 20 years. Okay, I was addicted to drugs for 20 years. So, and when I'm using the street language where people can recognize what I'm saying, because I'm meeting people's where they at. So when you say proper language, you meet people's where they at so they could understand where I'm coming from. And so I'm going to continue saying I'm clean. I know I never was dirty, but I was addicted. I was in a dark space. So when I was, and so that's when I bring that to awareness to the panel that this is the way it is in this community. So I meet people's where they at, and I speak the language where they understand.
I totally understand what Anita is saying as far as meeting them where they're at. That many communities that are heavily affected only speak that way. I think it's a great opportunity for us to get into their lives and to get to know them. And it also opens the door that then we can go ahead and talk to them about stigmatizing language where, you know what, you were somebody who got through substance use disorder. That first person language is really important. I also wanted to piggyback on something Kimberly was mentioned that we really didn't talk about, which is the drug-induced homicide. I will tell you that the drug-induced homicide groups, they roll deep. They roll real deep, and they know how to find their people. And they found me right away. And when I started going to events, I realized I was the only person of color. And then I started learning more and learning more. And unfortunately, I truly feel like those groups and what they stand for puts value on our kids' lives. Oh, my child died, one pill killed, as opposed to your child who struggled for 7 years. And then they
Unfortunately, Aisha, if you can hear us, we're experiencing complete mute on your side. But
I know what she's going to say, because, Broken No More is constantly fighting against this. The fentanyl families who are advocating really for harsh drug laws, for longer mandatory minimums, things that will keep killing people, basically. And it divides us as grieving parents. And they, the fentanyl poisoning families see themselves as their children were victims, they were preyed upon. And like my son used heroin and he overdosed. So he, like it was sort of his fault. Well, so they kind of divide the grieving families, and they're used by legislators, prosecutors, the DEA to foster and continue their own interest, which is continuing the drug war, continuing the prison pipeline, all the money that's made. I mean, follow the money. That's where this is coming from. And parents who have lost children are pawns in the game. They're being manipulated, used, and their grief is actually being used in a very harmful way, and a lot of them don't even know that. Aisha, I was kind of picking up, I knew where you were going, because you were really, you know, sort of one of their people they kind of picked, you know, to get involved. And I'm so thankful that you saw the light and saw what they were about. And you could finish whatever you're going to
Once
say.
I realized that it was my people that were going to be heavily affected, no, why would I go against my people? Like, why would I do that? I'm one, you know, so yeah, no, we can't do that.
Exactly. They the same thing happened to me. Exactly.
Jesse, did you have something to add?
I just think there's a common thread here with regard to the question about stigmatizing language and with regard to the drug-induced homicide laws. And we are role models for people who aren't as familiar with the data. And so if you are and you do the research, you learn, and you look at our history, you learn that these mandatory minimums do far more harm than good, and that a lot of innocent people get caught up in a mandatory minimum tying the hands of a judge, and it just makes no sense. But people's passions can get the best of them sometimes. But I believe that we can be role models and that we can help people to understand that the language is stigmatizing without being judgmental or harsh. So I think it's really up to us, and you deal with different people differently. But data is on our side. And so it's not as though the drug-induced homicide laws have done any good anywhere. And it's just like the crack cocaine in the 80s. It's just took us years to get over the most horrendous law that lawmakers passed without doing the research and without understanding the science. And there's no excuse for it.
And who did it target? Black and brown people.
Everything.
Black and brown people.
It applies to everything that we're fighting for.
Thank
I
you.
just want
Sorry.
I just want to add to that, because the way I feel is no one wakes up in the morning and says, I want to be an addict. No one. And no one wakes up and even doing drugs have the fear of they might OD either. You know, so I just want to state that the reason why I'm doing this is because of that, educating the community, bringing awareness to the community, and also meeting them where they at and keeping hope alive.
Absolutely. Thank you for adding that, Anita. And next question we have, I feel like we touched a bit on the drug-induced homicide undercutting Good Samaritan laws. But if Sam, if you would like to restate that question and ask it again, please feel free. I do want to move along to our next question. You know, you all are amazing, beautiful warriors. You know, as mothers, we have tremendous influence on policy. But, you know, a lot of advocacy groups are siloed, underfunded, and fragmented. And as people who do this personal storytelling work, it is a constantly feeling re-victimized and betrayed by systems while you're going in and talking to these elected officials or, you know, leaders in your community. How can we streamline our messaging and support one another without increasing the burden of on ourselves? I will say, I'll give other people a chance to jump in. And I know it seems like a very simple answer, but I definitely think it goes back to finding community groups or finding those advocacy groups that are, yes, similar experiences that you have experienced, but also a similar background or life that you have experienced, right? We've heard from Kimberly, Anita, and Aisha sharing how they were often the only person of color, woman of color, mother of color in these spaces, and how that was in and of itself a very isolating experience. I know it's a really obvious answer, but reaching out to groups like Broken No More and GRASP, you know, Black Moms Against Overdose, there is a need for organizing and for coming together in community, whether virtually or in person, as often as you can. I know that's a very obvious answer, so I will turn this over to any of the panelists if you have something to add. I do want to note that we have a few minutes left, so I want to make sure we are able to get to other questions. Go ahead.
I think that like with our children, isolation works against the greater good. And so I have found that connecting with other people that I've testified with or initiatives that we've taken on, such as combating the drug-induced homicide laws here in Maryland so far. I don't want to rest on our laurels, but it is the connection and the camaraderie, and I have found it to be very rewarding. And we may have different experiences, but you'd be surprised when you really sit down and talk how much more you have in common than you don't. My son had disabilities, so I'm sensitized to marginalized populations, even though I might not look like I'm in a marginalized population. He was. And so I'm very sensitive to that. So you talk with people and you connect, and that's what this human existence is all about. We need each other.
And I don't see a way around some of us not having to go up and be there to show up at the legislative sessions. Not everybody has to, but when there's a line of parents on the other side fighting for horrible, harmful laws, we gotta have a line on the other side. And it's hard and it hurts and you don't want to be there. And often our line is very short. It's one person, you know, and it takes a really brave person to go up and do that. But I don't see how we can not, and that's not for everybody. It's not, but the people that can do it, I think feel morally obligated, whatever it is inside us, but I think we as parents and family members, they have to hear our voices.
I spoke at the budget summary, and like she said, it was just a few people there to even listen to what they were saying. And I was there and I heard them say about all the cuts that they were doing. And some of them was for the harm reduction, mental health, and all of that. And I was saying, I got up and spoke, and I said, all of these things are needed here in the state of Wisconsin, which I see that you're taking funding away from. Why would you take funding away from things that are working and that are helping families to prevent drug overdose and bring education to them? And like I said before, keeping hope alive. These people are asking for treatments and they're constantly cutting the funding. So which eliminates people's seeking the help that they need.
Thank you so much, everyone, for answering that question. I do want to make sure that we're able to finish on time. So I'm going to switch us over from those questions to more closing remarks before I turn it back over to Dr. Tamara Alt. I want to share that we have got to be loud. You know, I know we've all heard the expression loud and wrong. We need to be loud and right, loud and accurate, loud and passionate, because in doing this work, I have seen how people do change their mind. Before I started doing overdose prevention work here at Vital Strategies, I myself I had some, progressive and yet some very narrow ways of thinking about people who use drugs and drug use and all of these things. And so I continuously am learning every single day. And when we have these conversations more one-on-one, and instead of trying to speak at people, but speaking with people, that will make other people pick up these talking points. And before you know it, someone who was kind of not trying to hear anything will start to kind of share the same messaging and thoughts that you have shared with them. And I know that is slow. And when there is an active crisis, that feels like it's not enough, and it's not, but it is something, and it does get us to places where that line will, on the other side, our line will start to get longer. And this is why we have these press conferences and do campaigns and all of this, because we know that people know that something is not right, but they may not know about harm reduction. They may not know that services are being cut so much, right? They may not be aware of these things. And this is why it's important for us to have these conversations, and why we're so thankful for each and every one of you all who took time out of your day, in the middle of your week, in the middle of your day, to listen to us. I am going to turn it over to Tamara so she can close us out. Sorry, Tamara, really quickly, I want to read this wonderful message from Jen. Just wanted to say thank you for fighting the good fight and pushing back against increasingly punitive and carceral policy for people who use drugs. Mad, mad respect and love to you all. Tamara?
That's really nice. Thank you. I want to thank the journalist again. I hope you've heard we've laid out what the problems are and what we need to save lives. And we count on you to give our viewpoint and it's not just a viewpoint, we have evidence. We have evidence about what works, and we hope that you'll share what we've said today, because our message has to be shared more widely. Us just talking here and there, we need it spread throughout the country. So any journalist who pick up this story and publish it, we appreciate it so very much. It will save lives. It will help us enact better laws. So thank you for being here. And I hope you'll share our message today. And thank you so much again to the speakers. I know, I get it. I know how hard it is. Thanks for putting yourself out there, and to Vital Strategies for helping us organize this. I'll be just a little more existential to end it. I showed the speakers a shirt that I'm wearing. It's a Bob Marley shirt that I just ordered, and it says "One Love" on the bottom. I just was feeling like, what's going to motivate me? What should motivate all of us to make change? It's one love. We're one community, one society, one species. And there's so much othering and stigmatizing and judgment, and you're poor and you're this color, and but we're one. We need to be one love, one heart, and carry on these important messages. Care for each other. Every life is valuable. Every life deserves dignity, whether you use drugs or you don't. And there are a lot of drugs that people use. Some of the ones we're talking about today just happen to have been arbitrarily assigned to be illegal. And our people are criminalized and put in cages, but there's lots of other substances that are used that are harmful, right? So we got to kind of drop the judgment. We all have our thing. None of us sitting here are perfect either, myself included. So my call is for love, compassion, empathy. I don't see a way around getting things changed unless we can evolve, all of us as a species, to call on those values, those just innate qualities. They're going to help us help each other and be kind. So I know it's not, change this policy, change that. We've already talked about that, but I just call for kindness and compassion and love, and fighting back against so much harmful things that are going on. We could do this. It matters. We are not done. We won't give up. We're here in the name of our children, and also the wonderful people like Gloria and Tony, who haven't lost someone, but they're in the fight with us because they're good humans. They understand compassion, empathy, kindness. They get it. And those are some of the most amazing people I've met on this journey. They're not parents. They just care. They're just amazing human beings. Anybody in the whole harm reduction community I've been in awe of, that I've met along my journey. So thank you, everyone. I hope you have a great rest of the day. Light a candle for all the people that we've lost on International Overdose Awareness Day. Go to an event. Be kind to someone that day. Maybe somebody you wouldn't normally talk to, or you wouldn't normally pay attention to. Let's do it in honor of all the people that here that can't do that. And most of them were really kind, wonderful souls, and their lights were extinguished way too soon. So thank you all, and love to you all.
Can I just say one thing? If I had to boil it all down, I would want people to know that using drugs is not indicative of a moral failure. It's not a character flaw. Bottom line, it is that perception that has taken us down the road that we're fighting to recoup from.
Absolutely. Thanks, Jesse.
Thank you all. This call was recorded and will be emailed to everyone who RSVP'd to attend. Please enjoy the rest of your day. Hold this feeling, this memory with you, and look out for the email recording. Thank you.